What is the gold standard for treatment of chronic pain? Hi, I'm Dr. Ruth, the Pain Doc, founder of Chronic Pain Rescue, a telehealth practice devoted to helping those who suffer from chronic pain using holistic and integrative approaches to become pain-free. It is possible. It is possible, and I'm here to let you know. But I think this is a great question because I think a lot of people are not aware of the answer. The answer of what is the gold standard for treatment of chronic pain is a psychotherapy known as cognitive behavioral therapy. And if you're surprised about that, I would be too, because so many years I've practiced over 20 years in physical medicine rehab, practiced in working with patients, clients with chronic pain. And to be honest, I have yet to, until recently, meet any counselor or psychotherapist that treats pain or utilizes cognitive behavioral therapy. And yet it has been around for many, many years. Just to say, first of all, a definition of what cognitive behavioral therapy is. And I like the definition I found in Psychology Today. Cognitive behavioral therapy is a short-term form of psychotherapy based on the idea that the way someone thinks and feels affects the way he or she behaves. CBT aims to help clients resolve present-day challenges like depression or anxiety, relationship problems, anger issues, stress, or other common concerns that negatively affect mental health and quality of life. The goal of treatment is to help clients identify, challenge, and change maladaptive thought patterns in order to change their responses to difficult situations. Now, before you get perhaps offended by the idea that we require working on your mental health, no one is saying the pain is in your head. Nobody's saying that your symptoms are not real. The fact is, people who suffer from chronic pain, there has been significant changes in your central nervous system, in your immune system. Your immune system got stagnated, got stuck in a chronic inflammatory state. Your central nervous system has become basically hijacked so that your limbic system, which houses your emotions, is on hypervigilance, hyper-stressed. Your thought processes have been hijacked. Your whole way of thinking and doing now revolves around your pain, whereas you would want to be in control of what you do and think. The pain has taken that over. So it makes sense that we have to approach this from multiple disciplines, multiple approaches. As I've described in the past, it's like that huge beast that we have to take every weapon available to fight it and to kill it, to subdue it. Chronic pain is like that. So what does CBT involve? What is the premise behind it? First of all, it's been around since the 1960s and 70s. It was developed, created by a psychiatrist known as Dr. Aaron Beck. He was dissatisfied with the results of treating people with depression and anxiety. He felt there were no changes in their situation with the previous known ways of dealing with psychotherapy. He wanted to make differences in their behaviors, differences in their thought life, so that they could change maladaptive ways of thinking and being to things that were adaptive, things that would heighten their quality of life. And it has been shown to be effective with things like depression and stress. But what's amazing is that it also has been significantly effective in so many other areas: eating disorders, weight loss and weight optimization programs, smoking cessation, addictions, conflict resolution with couples therapy, and with chronic pain. The results haven't shown all people with chronic pain have been positively affected in terms of lessening of their pain. There was meta-analysis looking at 14 different trials of patients with fibromyalgia who benefit from CBT, but not in terms of pain relief. In their cases, the majority of them got relief of depression, relief of stress, and were better able to function, even though their pain levels were not significantly improved. However, some other studies, Dr. Schnappel et al., with people suffering from low back pain. Their article was Unlearning Chronic Pain, a randomized controlled trial to investigate changes in intrinsic brain connectivity following cognitive behavioral therapy. Basically, they found that by providing transformative treatments and strategies to improve the quality of life, those living with pain, these approaches, by changing their thought life, changing their maladaptive thinking to, non-catastrophizing or no non-absolute thinkings, rather than saying this must be, this has to be, this should be, to this is what I prefer. If things don't happen this way, I'll be okay. Just changing their thought patterns and changing their behavior patterns actually also not only improved their mood, their function, but also improved their pain. So just to go into a little bit of what CBT involves, there's a CBT pyramid. You can picture, or triangle rather, CBT triangle. Picture at the apex would be your cognitions or thoughts. The left lower corner would be your behaviors. And your right lower corner would be emotions. And let's say we're talking about stress or talking about depression. That is an emotion. You may not be able to just turn that on and off, to just change. I'm depressed, I don't want to feel depressed. Or I'm stressed out, I don't want to feel stressed out. So you may not be able to directly affect the emotion, but by either changing behavior or by changing thoughts, you can impact on the emotions. Let's say when you're someone who gets depressed, you tend to stay home alone and you don't go out and you don't do anything. Well, a way to change that depression and that isolation would be, I'm going to go out. I'm going to go out for a walk, out and walk for a walk in the park. I'm going to take the initiative to call a friend. That change in behavior can actually work to change your emotions or change your thoughts and therefore change your emotions. So that's basically what cognitive behavioral therapy involves. There's a lot of approaches and a lot of ways. Basically, it's ways to help you help yourself. That's why it has long-lasting results. That once the therapy, only 5 to 20 sessions are needed of cognitive behavioral therapy, which is great. It's not something that you have to do for a long time, but once you've learned how it works, you can do that for yourself, and it has long-lasting implications. They've checked on people a year later, 3 years later, they still are managing their pain, they're still living a higher quality of life, and these are things that I offer in my program. We have a group program that will be starting soon. Certainly, you're welcome to join when we have our next chronic pain masterclass, which will be a free session, and you can hear more at the end about the beginning of our upcoming sessions. So I do hope that if you're someone suffering from chronic pain, that you'll take that opportunity to work with me. I'm here to work with you to help in whatever ways I can to relieve you and to help you get back on your journey to life and health. Until next time, peace and blessings.